Do you know what to do if you get sudden eye pain? Everyone should know the steps of how to protect their eyes and preserve their vision if they happen to get sudden eye pain. Hi everyone, Dr. Nagori here, board certified ophthalmologist, and you're watching the eyefacts.com channel. Now let's get into the 5 steps of dealing with sudden eye pain. Number 1 is pretty obvious. You want to figure out what happened. So sudden eye pain usually has some kind of external trigger, meaning your eye itself usually isn't causing the problem. We will get into something that is within your eye that can cause the problem. But you want to look at what you're doing. Are you outside? Are you wearing eye protection? If you're outside, it's very possible that something unknowingly has flown into your eye. And this is probably one of the most common reasons for sudden eye pain, is something getting stuck in the eye without you realizing it. So you want to move your eye around, you want to hold your eyelid sort of off the eyeball and see if you can dislodge that foreign body or eyelash. So what you're gonna wanna do is really just pull your eyelashes, you'll look down and try to release the upper eyelid off the eyeball and move your eye around when you're doing that. That'll help to release anything that might get stuck. Okay, step number 2, if that first step doesn't work, the second step is to check your vision. If you are having decreased vision and the pain is not going away and nothing seems to be stuck in your eye, you really wanna head to the emergency room. Sudden eye pain, especially if the eye is red, could be a sign of something called acute glaucoma. It is not very common. It's certainly not as common as just getting something stuck in the eye, but it can happen, and it can happen without warning. It can even happen without a previous history of glaucoma, but it is very uncommon in general when compared to just getting something stuck in the eye or having something like a scratch or a corneal abrasion. But if your eye is red and your vision is down and there's pain, head to the ER. Step number 3, if your vision's okay and you haven't seemed to dislodge the object and the eye doesn't seem to be too red, you might want to try using some artificial tears. In an ideal situation, you use preservative-free artificial tears, but I understand that may not be something you have available at home, so you want to use artificial tears. Now, if you don't have artificial tears, you can actually just rinse the eye out with some water, which is what we do in like those eye wash stations if someone has a chemical exposure to their eye. But the main thing before you do this is you want to make sure that if you do wear contact lenses, that you remove those before you start putting more things into the eye. Okay, step 4, look in the mirror. Is it red or is it white? Again, a painful red eye is going to be more concerning than a painful white eye. As mentioned before, a painful red eye could be a sign of glaucoma, but a painful white eye could just be dry eyes that are getting aggravated. So using artificial tears, as mentioned before, could be very helpful. Step 5 is either schedule an appointment with your eye doctor, or if you're having, of course, extreme pain or vision loss, you want to go to the emergency room. Vision loss can be a sign of something more serious, like optic neuritis, that can also be associated with eye pain, especially eye pain when you're moving the eye around, or something like acute glaucoma. Now, retinal detachments can also cause vision loss without any warning, but they usually do not have pain associated with it. So if you're having pain and vision loss, it's unlikely that it's a retinal detachment, but it's in the realm of possibility. So either way, you're gonna wanna get checked out, but typically retinal detachments are painless losses of vision. Hope you found this helpful. Remember to hit like and subscribe below, and I'll see you in the next video.